at the Population Health Research Institute in Canada, along with our colleagues in Colombia, Malaysia, and the United Kingdom, have been working to reduce hypertension and cardiovascular risk as part of the HOPE4 study. Hypertension, which is one of the biggest contributors to cardiovascular disease, is a significant burden. There's simple medications available that can help reduce this risk, but unfortunately we know the detection, treatment, and control of hypertension is poor around the world. We also know statins are helpful to reduce cardiovascular disease in participants with hypertension. This medication, unfortunately, is only used in less than 5% of that population. So we set out and we did systematic reviews and 2 health systems appraisals in Colombia and Malaysia to help identify these barriers to hypertension management as well as cardiovascular risk reduction. This information then informed the design of the HOPE4 intervention. So the HOPE4 intervention involves 3 core components. The first is that of task shifting to non-physician health workers, where they're supported by computer-based tablets with simplified management and counseling algorithms. We also provided combination antihypertensives as well as a statin, which were recommended by the non-physician health workers, but supervised by local primary care physicians. The third component was that of improving adherence to medications and healthy behaviors by involving family members. So the HOPE4 trial was an open, community-based, cluster randomized controlled trial involving participants that were 50 years or older with new or poorly controlled hypertension. We randomized 30 communities and 1,371 participants and had 97% follow-up at 12 months. The key findings were that of a primary outcome was a significant reduction in the Framingham risk score, with an absolute reduction of 11.2% in the intervention group versus 6.4% in the control. We also had significant reductions in blood pressure at 11 millimeters of mercury in the intervention group, which was an absolute reduction above control. We had a 0.4 millimole per liter reduction in LDL. And we also saw significant improvements in medication adherence as well as several other health behaviors. So I think what's important is the HOPE4 intervention. It's comprehensive. It was non-physician health worker led. It involved simplified management algorithms on computers. We provided free medications to these individuals, and we enhanced adherence to medication and health behaviors by involving family as well as friends. This significantly reduced cardiovascular risk as well as improved hypertension control. We feel that if the HOPE4 study is adapted to local contexts and implemented at scale, it could help address the United Nations General Assembly Action Plan for a greater than 1/3 reduction in cardiovascular premature mortality.